This is 9 News Now.
Misdiagnosis then can get a child labeled with a learning disorder. A health alert on what may really be wrong. That's coming up. Topper. A fidgety, easily distracted, antsy kid can sometimes get labeled with attention deficit hyperactivity disorder. But in tonight's health alert, how a vision problem may be the real reason some kids just can't pay attention.
When I was 7, I was tested for a learning disability and it came up ADD, ADHD.
And years later, 20-year-old Antana Asfal thought he was still dealing with attention deficit problems when during his first semester of college, he couldn't sit still to read longer than 15 minutes at a time.
I signed up for about 4 classes and I ended up dropping about all of them, I think.
After being tested for a learning disability, he was sent to Dr. Amanda Zeller, a developmental optometrist in Chevy Chase, Maryland. She says mental focus wasn't Antana's problem, it was his eyes, something called convergence insufficiency disorder.
So convergence insufficiency is a problem where the two eyes don't properly align at near. So when a person is trying to read, work on the computer, knit, their eyes don't come together to look at the object easily.
Symptoms include eye strain, headaches, double vision, squinting, covering one eye to read, and an inability to concentrate.
And it would just be normal, but then it would start to blur and I would see like 2 of the word, or it would be like smudged.
Walk along the street.
And the only relief for kids like 5th grader Ava Phelps is to consistently look away, leading some to think they aren't paying attention or could have ADD.
When it really it's that they can't. Not that they have a brain disorder that prevents them from doing this, but it's an eye coordination issue that's preventing them from paying visual attention to the task.
Dr. Zeller says the disorder is curable with special vision therapy. Antana is proof that is true.
So I noticed my first exam I got a B, so compared to the CDs that I was always used to getting.
Now, Dr. Zeller says kids should have their eyes checked at least every 2 years as they grow. However, this disorder isn't always caught in a regular exam. So if parents notice the symptoms we just described, ask to see a specialist. Tomorrow morning at 6:15 a.m., we'll show you some of the exercises used to cure convergence insufficiency disorder and some of the kids they've helped a whole lot.